Hello and welcome to the tutorial on joint and long bone immobilization. I decided to combine these two into one tutorial because basically they're very similar, the steps are the same. Remember, as far as testing purposes, come in, scene safe, BSI, and then the very next step is to direct your helper or partner to take manual stabilization of the injury site, which depending on if it's a joint or a long bone, basically they're just going to come in and support above and below where it's injured to take weight off of it, and that way the patient can kind of take a rest so they don't have to splint it themselves anymore, which in real life a lot of times you'll find them self-splinting and doing on their own. Once you do that, your very next step before applying any splints or doing anything else is to check pulse, movement, and sensation distal to the injury to make sure that you still got blood flow, sensation, and movement. Once you do that, then you start the steps of splinting the injured site. Let's talk about joint injuries first. Joint injuries would include things like the shoulder, the elbow, the wrist, the knee, and the ankle. Let's take each one of those real quick to talk about the splinting methods that work best for that. If it's a shoulder injury, basically what they need is a sling and a swath. To take the weight off of it, once you sling and swath it, sometimes you could also place a pillow in between or under their arm, depending on where their position of comfort is. But for the most part, they need a sling and swath for a shoulder, an isolated shoulder dislocation or fracture. Elbow, the easiest way to do the elbow, most of the time they're going to want to hold it in a flex position. Remember, with any joint, you want to immobilize the bone both above and below the injury site. So the easiest way to do an elbow, I like the A-frame method. You would take two short padded board splints, and remember we practiced in class, this is where your partner is holding manual stabilization. You would come in with a board below and then a board above, making kind of an A, upside down A in this case. Then you would use, the easiest thing would probably be to use cravats to capture and hold the two padded board splints in place. And basically what you're trying to prevent, once again, injured elbow, we want to immobilize the bone below and the bone above. Now I would finish it up with a sling and swath. So after I had the entire contraption in place, I would sling and swath it, and then remember your very last step, check pulse, movement, and sensation before you're done. With a wrist injury, and I'll cover wrist and ankle at the same time. Those are the easiest injuries usually to take care of. With the wrist injury and an ankle injury, we usually use a pillow splint. And basically, we would just take a pillow, wrap it around the wrist, making sure to leave space where we can see the fingers and see the hand, and preferably get to the radial pulse, because remember, we still have to check pulse, movement, and sensation after we apply. And then we would use like 2-inch tape to basically wrap this into place and secure the wrist. Same way with the ankle and a pillow splint. Of course, if your patient had a shoe on, you would remove the shoe and the sock so you can visualize the injury. But most of the time, we're just going to use a simple pillow splint. Once again, 2-inch tape taped around to protect and secure and immobilize the ankle, leaving the top of the foot available for checking pedal pulse and making sure you can still see their toes to assess sensation and movement as well. Last one we'll talk about is the knee, and that one kind of depends on how the patient's found. If the patient's got a knee injury and they've already got their leg straight and that's their position of comfort, then basically you would just come in, 2 long padded board splints on either side to, once again, immobilize the bone above and the below, the bone or bones, in this case, tibia and fibula, below the knee. Remember that you also want to make sure that as you're wrapping it, you capture the ankle so that they can't, move their ankle a whole lot, and then check PMS at the end. All right, let's work our way back up. Now we'll be talking about long bone injuries. Oh, sorry, I forgot. With the knee injury, we talked about if you find it straight, if you find it in a flexed position, which will probably more than likely what you'll find with a knee injury, because that's usually their position of comfort is flexed, then you'll simply use the longer padded board splints to do an A-frame here, like we did with the elbow. But we want to make sure we immobilize the bones below and the bone above. The easiest thing to do is use cravats to secure these two boards and sandwich the leg between the two boards. Remember, once again, check PMS once you're finished. All right, let's talk about long bones now. We'll work our way back up. We'll start off with a tibia fibula fracture. Obviously, most of the time you're going to find them with a straight leg position. In that case, much like with the knee injury, two padded board splints on either side, sandwich the leg between them. Remember, with a bone, we want to secure the joint above and below. So in this case, we want to make sure we secure it where the knee won't move and we secure it where the ankle won't move, because that would be securing the joint below and the joint above. Follow it up. Last thing we do, check PMS before we finish the station out. We won't talk about femur fracture, because with an isolated femur fracture, you'd be using the traction splint in that case, which is a whole different station and a whole different skill. All right, with the other long bone injuries, the other ones, you're looking at the clavicle or collarbone. With that one, they simply need a sling and swath. Much like the shoulder injury, you're just looking to take the weight off of it. It's pretty much impossible to put a splint itself around the clavicle or collarbone, so we simply do a sling and swath. Next would be the humerus. Same thing, sling and swath with the addition of a padded board splint along the outer edge of the humerus. When you have a humeral fracture, it can be very unstable, and so you need a rigid splint to basically hold it together. Now, once you apply that to the upper arm, then you would follow it up with a sling and a swath as normal. Probably the most common one we see is a forearm radius ulna fracture. This is an easy one too. Most common way, padded board splint to the forearm. The other thing with that, remember, you want to put the hand in position of function. So have your partner hold manual stabilization and basically give the patient a piece of rolled up gauze to hold, put their hand in position of function. Apply the splint, a cravat or roller gauze above and below the fracture site or where you see bruising and swelling. And then you would follow that up, slowly bring it to the patient's chest, apply a sling and apply a swath. Remember, the swath is the cravat or two cravats tied together that simply goes around their whole body to keep them from lifting their arm like this, so we immobilize the shoulder joint as well. And that pretty much covers most of your long bone fractures. Remember, same steps in all of the immobilization scenarios. Scene safe BSI, direct your partner to take manual stabilization, check PMS the first time before you splint, apply the splint using the appropriate method. Once you finish that, your partner can let go of manual stabilization. In fact, you've probably kind of had them help you hold the splints in place while you tied them in place. Up to that point, they can let go. And then when you're completely finished, the last thing you do before you close out for testing purposes and in real life is check pulse movement and sensation, because you always want to check that again, compare it to what you found the first time. Make sure that nothing has changed, especially for the worse. Hopefully splinting maybe have even made it better, and that's what we're looking for, is to make the situation better. All right, thank you for watching.